the first thing we do, and we actually trademarked it, it's called the VInton Method, and it's just a culmination of a bunch of different exams, but literally doesn't matter whether it's your hip, your big toe, or a headache. We do a full body exam from the very top of your head all the way to the soles of your feet on every single patient, because we're looking for where the interference is, and we already know what hurts, and we just trace that back to the point of interference. So for a hip, is it something in your neck that might be out of alignment, throwing your posture? So we have bilateral weight scales. Not uncommon to see somebody carry 50 more pounds on, let's say, the right-hand side than the left-hand side. Well, over time, that imbalance in posture, which can also come from a dropped arch, it can come from something wrong in the back, it can come from something wrong in the neck, but that can wear a joint away. So we need to determine that first. Second thing, we're going to do an exam and find out if any of the nerves from your neck or your lower back that go down your spine into your hip are interfered with, especially number L4 and L5. They come right through the hip on the way down to the leg. It'll often feel like you have hip pain or knee pain when in fact it's stenosis or a pinched nerve or a herniated disc in the lower back. Now, it could also be a very damaged hip as well. It could be a dropped arch in the foot contributing to all of that. So we look at all of those factors, but that's how we get such a high success rate, because let's assume you have a dropped arch. Well, that's a simple enough thing. A pair of foot levelers balances that out, straightens out your gait and your posture. Let's assume that it's the very badly degenerated hip. We could use stem cell therapy to inject into that hip and help that hip to regenerate itself like it was 15 or 20 years ago, right? So not only do you get the pain relief, but the joint itself actually heals. Now, you won't be like you're 20 years old again, but you clearly will peel 15 or 20 years off the damage that was done. Now, whatever beat your hip, it might have also beat your lower back. So we have probably a half a dozen different ways, from neurospinal alignments to a device called the VAX-D, which can decompress those discs and take pressure off any nerves or degenerated discs that exist. We can also use stem cells in the back. We can use something called pulsed electromagnetic field therapy to just reduce inflammation in the back or the hip or wherever. We could use a class 4 laser in conjunction with stem cells or VAX-D to, again, help reduce inflammation, help promote healing. So the first thing that we do is a full body exam, and we tie all the pieces together, get x-rays if necessary. If you flunk those, we'll get an MRI. And then once we have the data and know what the cause of it is, then we can best determine what the solution is.